me great pleasure to hand over to Avril Kennan, who is the CEO of HRCI, who is going to just give us a brief introduction. So it's over to you, Avril. Thank you.
Thank you very much, Mark. So as Mark said, yes, I'm the CEO of Health Research Charities Ireland. We realised that we are HRCI, but we run the IHRF. We realised that there's some similarity between those acronyms, and hopefully we don't confuse you too much with that. It's a really busy time of year. I think we're all feeling that, and it's very hard to find the time for meetings like this. So thank you very much for being with us here today. One of the things we really wanted to do today was just acknowledge how hard it has been since COVID first visited us. No doubt every person here has experienced personal challenges, and then we've also had very particular challenges that relate to health research and our particular roles in health research. So we just wanted to give that a bit of space today, and also to thank you. The type of people who attend these IHRF events tend to be leaders, tend to be focused on creating positive change, to be outward looking and willing to engage with other stakeholders. And we know that you're the very same people who have been keeping the health research show on the road. So a very genuine thank you for all that you've been doing. I particularly wanted to mention the group closest to my own heart, which is the Health Research Charities. Many of our approximately 40 member organizations represent groups that are clinically vulnerable to COVID. And they've come under immense pressure to provide leadership, even at a time when none of us had answers around the impact that COVID might have on particular patient groups. They also, as you can imagine, have taken a very big financial hit across the board, but particularly those smaller organizations that are volunteer-led or have very small teams and who weren't able just to transition into an online fundraising model easily. And of course, that has meant that there's been a big impact on the research that they can fund. And that's a really difficult thing when your main role, and in some cases your only role, is to drive forward research. They've also reported, 70% of our members reported at the end of last year that due to COVID and in more recent times due to the HSE cyber attack, that there have been delays and in some cases cancellations to research that they fund. And beyond what they fund, there have been just so many impediments to the wider research that their communities are depending on. In many cases, this is because of challenges with access to patients, but also things like data collection stalling on charity-supported patient registries. Having said all that, they have somehow carried on achieving amazing things over this time. So they've worked with their research collaborators in all sorts of ways to keep things moving forward. They've moved PPI activities online, conferences online. It's not the same, but in some ways they've managed to reach bigger audiences and more diverse audiences through doing that. And maybe in the greatest example of pushing through difficult times, this year we have 18 of our member organizations participating in the joint funding scheme. That's the largest number of charities that have ever participated in the scheme. So for those of you who aren't aware of what that is, it's a scheme that we run in a fantastic partnership with the Health Research Board. It's the charities that determine what research they want to fund, what's most relevant to their patient communities, what's most likely to lead to impact. And then it goes through a process with the HRB, and successful projects are co-funded by the charity and the HRB. It's a beautiful model actually of PPI in action. And we're gobsmacked by how many charities are managing to take part at such a difficult time financially for them, but they're determined to make more and better research happen. So stick with us for the rest of the event. We have really exceptional speakers today, and we're very grateful to them all for being with us. So finally, just to say, we have resilience in our title for the event today. This week, it really feels like we need to dig deep again for that resilience, and I hope this event will help a little bit.